Hey, this is Dr. Renicky with CellGen Regenerative Medicine in Savannah, Georgia. I wanted to take a moment to talk with you about how regenerative medicine could help for hip pain. So we're going to be talking about the actual true hip joint down here where the leg attaches in, as opposed to not somewhere back here in the lower back. People oftentimes call both of those the hip, but right now I want to talk about where the leg attaches into your pelvis over here on the side, that ball and socket joint. So inside of that ball and socket there is cartilage that should be creating some space there. But many times over the years, because of injuries and problems that we've had, that cartilage has gotten worn away faster than the body is able to keep up with rebuilding and repairing it. And you're getting to a point where the joint is becoming almost, if not totally, bone on bone. And of course, lots and lots of pain will happen then. Unfortunately, I would say that we don't really feel a lot of pain when the cartilage is just starting to wear faster than the body can keep up with rebuilding and repairing it. There will be a long time of the cartilage wearing away before you're going to get told that anything is wrong, before you're going to get the pain that lets you know that there's an issue. And then unfortunately at that point, there may not be a lot that your body's going to be able to do about it anymore. And so you could be looking at hip replacement surgery as an option for that. And hip replacement surgery certainly can give people a lot of their mobility back. But every surgery, of course, carries certain risks and complications. And it makes sense to try everything you can conservative first before going that surgical route. Once surgery's been done, there is no undoing it. You can't unring that bell. So if it doesn't work well for you, if you have a complication, then there isn't any way to reverse that usually. But when you're trying the more conservative approaches first, then you always still have surgery as an option should anything and everything else fail. So how would regenerative medicine work for this? Well, when we inject stem cells into the hip joint, those stem cells will become whatever tissue the body needs them to become. So the body has signaling chemicals called cytokines that will track the stem cells to a specific area of the joint that is the most damaged, and also then signal to those stem cells that they should become new bone cells, or they should become new cartilage cells, or they should become fat cells, or whatever type of cells seem to be most needed and most appropriate. And when we are doing a stem cell injection at CellGen, we're also introducing in with it another liquid that provides all of the support structures that are needed. So in other words, it's going to provide growth factors and scaffolding proteins and things like that that will help the stem cells to be able to take the appropriate organization, to be able to come the size and shape of new cartilage or bone or muscle or tendon or ligament or fat or whatever they need to become to be able to make that joint start to regenerate and to stop any further degeneration from happening. So we've got a gentleman that we did this with recently in our office. He has been very, very overweight for a very, very long part of his life and had gotten to a point where he had to be in an assisted living facility and was wheelchair bound because of how bad the pain in his hips had become. He wasn't able to hold himself up, support his own weight anymore. And so we did stem cell injections into both of his hips, and roughly about a month later, his daughter told me that he was getting himself out of bed and being able to do some cooking and standing while cooking and making dinner for the family, because now he didn't have to spend all of his day in the wheelchair. He hadn't gotten up totally out of the wheelchair, thrown the wheelchair away, but nonetheless was starting to gain some ability to carry his own weight and be able to stand. And more regeneration will keep happening for him. And I expect to see his level of function and improvement continue to increase. But for only a month later to be able to start getting out of the wheelchair where everything had been nothing but a constant downward spiral before that, it's really quite an impressive turnaround for him. So there is a lot of hope and a lot of potential for people with hip problems with regenerative medicine. And I would certainly encourage you to find out if you're a candidate for that or not. So feel free to give us any comments or questions below, but also by all means contact our office to find out if we can help you or not. Dr. Renicky with CellGen Regenerative Medicine in Savannah, Georgia.